It's important for physicians and providers to understand the connection between type 2 diabetes and heart failure. I've been working in the diabetes and cardiology space for over 20 years. And for the first 15 years of that, we were really focused as a cardiology community and as an endocrinology community on the atherosclerotic cardiovascular disease risk associated with type 2 diabetes. And that we realized there was some heart failure risk. It's only been the last 5 to 7 years where we've really gotten a better understanding of the critical importance of considering heart failure as part of the cardiovascular complications of type 2 diabetes. This has been driven by better epidemiology, partially driven by our improvements in outcomes for ASCVD that has allowed the heart failure signal to rise to a point where people with type 2 diabetes are similarly likely to have a heart attack as they are to have heart failure now. So it's really risen to a high level of population prevalence in the patients with type 2 diabetes. And now we have some medical therapies that not only overall mitigate cardiovascular risk, but the SGLT2 inhibitors specifically have a potent effect both on the risk for developing heart failure, and more recently we've seen for the treatment of heart failure. So this really has entered the conversation where we are considering heart failure at very much as high intensity as we do for atherosclerotic cardiovascular disease. You know, early in my career, as I was embarking on a career in cardiology, I decided as a second-year resident that I was going to focus on diabetes and its cardiovascular complications. And that was driven exclusively by the complete lack of evidence that we had for cardiovascular risk, both outcomes, efficacy, but also importantly, safety. We didn't even know if the medications available were safe. Now, at that time, the only medications we had available were insulin and sulfonylureas. And soon thereafter, around 1995, metformin came online, but we really had very little information other than the glycemic effects of these medications, what their longer-term consequences for cardiovascular and other clinically important outcomes. So it was an accident that I got interested in this. I chose a topic for a Grand Rounds type presentation called ischemic preconditioning. And I thought when I picked the topic, I'd be talking about how ischemia induces new blood vessel formation in the heart, and that we could get around ischemia by forming new blood vessels. And it turns out that this ischemic preconditioning phenomenon is a molecular entity mediated by the ATP-dependent potassium channel. And the reason that's important is that's exactly the target of action of sulfonylurea medications that block the ATP-dependent potassium channel. So the question arose is if we're blocking this cardiac protective mechanism with the medicine we're commonly using for hyperglycemia, might they be deleterious? And so I embarked on my career to really try to explore the sulfonylureas and ideally, and as we've done over a 20-year effort, build an evidence basis where we know drugs first and foremost are at least safe, and ideally, as we've discovered, some can be incrementally beneficial from a cardiovascular perspective.